Okay, welcome to lesson 1 of Principles of Health Science. It is over leadership. Now, the big question to answer is, what is leadership? Just to start off with. And a leader is one who guides people towards group goals. Now, what are some characteristics of leaders? Well, first we should know that leaders develop by their own efforts. And this means that they are able to take charge and do things in order to lead a group to success by their work. And then every member of a group who contributes is a leader. Whether this be a leader of different tasks or a leader in different categories, which I'll look at later. Now, leadership can change based on group goals. So group goals are the most important part when it comes to leadership. A leader is chosen based on what you're looking for from a group. Now, there are characteristics of good leaders. And some of these characteristics include being respectful, being able to show some confidence, but the biggest thing is to uphold democracy. And not all leaders will do this, but upholding democracy, well, that means that you are a listener and you are able to respect others' opinion and you're able to take criticism while be open-minded. And then good leaders are also very strong, appropriate communicators. And then they are able to give praise and give credit to others, all a big part of democracy, seeing your people under you as fellow members rather than the people under you, right? And there are some categories of leaders that we should look at, and this includes religious leaders, okay? So let's give an example of each type of leader. So your religious leaders could be a pope or a priest, okay? So these are religious leaders, and then there are political leaders. And this includes presidents. So this could be Donald Trump, right? And then there are club or organizational leaders. And this is not your clubs at school all the time, but they could be like John R. Safran, who leads the American Cancer Association, okay? And then there could be business leaders, right? Leaders like Bill Gates or Mark Zuckerberg. And then there are community leaders, and these are your town mayors or your school board members. So we can write town mayor. And then lastly, there are peer group leaders. And this is going to be your club presidents and all of the things at school, club advisors. So this could be our HOSA president or our HOSA advisor. Okay, so those are the types of leaders, the categories of leaders. The types of leaders are what I'm going to cover next. And there are 3 main types of leaders. So let's write types up here. Now, the first type of leader is a democratic leader. And these are people who encourage participation, they listen to opinions, they allow other group members to take responsibility. So I think a good way to write this is that they are very fair, okay? Our democratic leaders give people opinion, they give people chances. And then there's going to be our laissez-faire leaders. I don't think I'm saying it right, and these are people who are very hands off. And this can be useful when you're in a group that already has strong coordination and they're able to do things on their own. And having a leader that is going to take charge of everything can be kind of overwhelming or useless. So having a laissez-faire leader is not a bad thing, but it is when there's minimal influence from the leader and they avoid making decisions because often the group members can make these decisions for themselves. But it's not always great if you have a group project and nobody takes charge, especially those who are expected to, right? So this is, let's just say, hands-off person, okay? And then there's going to be your autocratic leaders. And this is when the leader is very, very dictator-like. They take total rule, they do the whole project themselves, or they tell you exactly what to do. They are very strict, and this can be very useful in situations that you need strong leadership, or it can be kind of unfair or even harmful when we look at things like people like Hitler, right? So let's look at examples of each of these. A democratic leader could be a president, right? So we could say Barack Obama or Donald Trump. And then a laissez-faire leader could be someone who doesn't have a lot of influence. It can just, hands off. So this could be maybe a club member, a club president, right? And if the club is very small and they don't need a ton of leadership, then the president might not do very much. And an autocratic leader, well, we can say a lot of dictators, but we can say Hitler or all of those, Stalin, everyone who dictates a group. And then there are changes to leadership or different situations that influence a leader's decision, and this is called situational leadership. And let me write. Now, situational leadership is when the decisions of a leader changes based on the context and the things happening. And obviously, there are 3 different factors that influence a leader's decisions in these situations. And obviously, it is the whereabouts and everything of the situation. So situation is one of them. And then it's the capability of the leader. If they're unable to do something, they should probably hand off this decision to somebody who can do the task, right? So capability of the leader. And then it's the capability of the followers or the team members. If the team can't handle a large amount of things, then maybe they should hand it over to a team that can, right? And a leader will adjust to whatever limitation or situation is put out in front of them. And that's a big part of what it means to be a leader. It's guiding your group, but they're developing and they're using good skills like democracy to change and lead that group to success. And adaptability is key, and a leader needs to be able to see the team dynamics and the different situations should be dealt with fairly. So something we need to add to the original notes is being able to adapt, right? So let me say a big adapt. That is a big part of leadership. So that is leadership for principles of health science. And your notes probably covered everything, but that's it.